Welcome back, viewers, to Faith and Discipline podcast. Today, our guest is Dr. Anwar. He is one of the respiratory consultants in the UK. Welcome, Dr. Anwar.
Mohammed.
Our first question is, what is asthma and what is the difference between being asthmatic and being out of breath?
Right, so asthma is defined as an allergic or hypersensitive reaction of your body to allergens. And allergens could be thousands of them. And it's actually overreaction of your body to any external allergens. And there is some role of genetics as well, and it runs in the families as well. The difference between asthma and being breathless means there are hundreds of causes of breathlessness, and you have to differentiate between lungs causing the breathlessness, or is it because of actually heart conditions, or it could be all because of anxiety as well. So people with anxiety can be breathless. So differentiating between asthma and other causes of breathlessness, you have to take a proper history examination and take further investigations, and then accordingly you have to plan your management plan.
What is the main cause? To be inherited disease, or is mainly due to the environmental factors?
So it can be inherited as well. So some children, they have a strong family history of asthma, and sometimes it could be environmental factors, mainly pollution. And there are lots of allergens like pollens, dust, grass. House dust mite is one of the most common one in England at least, and is quite commonly related to hay fever as well.
So are there any tests available to get the right diagnosis done, whether the person is really asthmatic, or do they have like once a blue moon kind of out of breathness?
So as I said, first of all, it's very crucial to take a proper history, and thorough history is crucial to make a diagnosis of any condition. And as I always say to my patients and my colleagues, 80% of your history gives you good differentials, as well as it can guide you whether it's asthmatic, or is it because of other lung conditions, or is it because of heart conditions. So to differentiate between asthma and other causes of breathlessness, you have to do some basic blood test. If you do full blood count, which will show you whether there's eosinophil count is high or not. You can do some allergens test as well. So some specific allergens test like pollens, dust, grass, cats, dogs, aspergillus, which is one sort of fungus as well, and is found quite commonly in damp areas. Particularly if you have quite a bit of damp at home, you're quite prone to develop asthma because of that, and even if you're exposed to damp quite frequently. So that's one of the blood tests. Then after blood tests, you can do spirometry, and the spirometry with the reversibility means if there's a provocation test, you do a breathing test, and after giving some bronchodilator, you have to retest their functional capacity after 5 minutes. And if there's a 12% increase in your lung capacity, it's a highly sensitive test. And you could ask to do the peak flow meter. Its peak flow is variable by 20% from morning to evening. That's quite good test. I use it quite often for my patients. So those are the tests. And if you're still not sure, you can do Methacholine challenge test, which is highly sensitive and quite diagnostic test.
Well, I'm just wondering, because you mentioned quite a few number of tests in there, does the patient needs to go through all those tests, or is there any specific ones that are right indicator whether the patient is asthmatic?
So current practice or current guidelines suggest if you're suspecting as a physician that this patient is highly likely to have asthma, you can give them a trial inhaler. So you can start them on inhaler called beclomethasone or QVAR. Most of people know about QVAR and Clenil, and that's
the one which is called like brown inhaler.
Yeah, absolutely. Layman term people use it as a brown inhaler. You can start with that, and blue inhaler as a reliever. You can use them. You can ask them to come back in 6 weeks and recheck their peak flow meter. If there's improvement in peak flow and symptoms are improving, then you're on a right pathway. But if you're indeterminate, you feel that there's a possibility of some alternative diagnosis, you should do investigation before you start the treatment.
Some people are concerned about childhood asthma, and it is also believed when the child grows older in their teenage or even grow older, they grow out of asthma. Does it happen automatically, or do they need any kind of medication to help with?
It is quite common when children have asthma when they're young, and they can grow out of it. But some proportion of patients, they can have recurrence of asthma, so it's variable. Some patients will be totally asthma free for lifelong, but some of them would be likely to be having a recurrence of asthma when they're adult.
Do they need to be on brown inhaler, or do they need to take like blue inhaler, that's salbutamol?
So it used to be a guideline that you start with a blue inhaler for many years. But then researchers have realized that it's an inflammatory condition. So we should always prevent. We should start with a preventer. So now the practice is to start with the brown inhaler and blue inhaler as and when required to prevent the attacks as well as prevent the inflammation.
And how much medication do they need to take? How do you prescribe how many puffs they need to take of the blue or brown?
So when you start the inhaler, you start the basic dose and you start with the lowest possible dose. Okay. And you ask them to take it for 6 weeks. Mm-hmm. And after 6 weeks, you ask them to come and see you again. Okay. You can check their peak flow meter, their day-to-day symptoms, whether they're able to do their activities unrestricted. Then you have to step up the treatment if they're still struggling with asthma.
What are the main triggers and how we can prevent them?
So main triggers, it's variable from country to country. Like in Asian countries, there's diesel fumes, pollution. Right. That's a huge problem for developing asthma. Okay. And countries like England, the major troubles are pollens, house dust mite, cat dander, dog's dander, and sometimes aspergillus, which is a form of fungus. So fungus in the form of mold or damp at home. There are actually thousands of them, but these are the common one in England.
If we look at the, different groups of patients, statistically, is it the younger patients who are the biggest victim of asthma, or is it the people who are older?
It's more common in young patients, but there are variable types of asthma. People can have asthma in late age as well, so we call them late onset asthma. Okay. But it's more common in youngsters. Okay.
Is there any link between asthma and eczema? Because it is quite common observation is like when a child is born with eczema, then soon after they develop asthma as well. So is there any link in between?
Definitely. Eczema and hay fever are the two conditions which put you at high risk of developing asthma. So it's quite closely linked with, so it's a condition called atopic asthma. Okay. So those patients are more prone to have more asthma attacks. They are likely to get worse as compared to non-atopic asthma.
Okay. As you talked about taking inhalers as like preventative medication, it's just for the management. Is there any medication just to get rid completely? I mean, like the proper treatment?
Unfortunately, this is allergic kind of condition for the humans. So this is very difficult to get rid of it. You would have to use the inhalers, although you might have to use less of inhalers if you're out of that area, like if you're gone in a warm area like Spain or somewhere where it's warm, you would probably have to use less of inhalers. But while in the areas like England, you would have to use the inhalers quite regularly to prevent the attacks.
Are there any side effects of these inhalers?
These inhalers, there is a myth that they're getting steroids into their body. But as compared to oral steroids, which has quite significant side effects to the human body, if you take it for a longer term, There's a risk of osteoporosis, diabetes, cataract. But inhalers are fairly safer than those. But over the years, many years, 25, 30 years, you might have some side effects related to this. But one of the major side effects we have to be wary of, that people can develop pneumonia if they're on inhaled steroids, if they're on high dose of inhaled steroids. So we have to be very mindful that we're not putting at them. But you have to weigh the balance between risks and benefits.
When you said like the other steroids, are we talking about prednisolone?
We're talking about prednisolone mainly, and dexamethasone and hydrocortisone.
Is there any alternative therapy? If someone wants to try alternative medication and they believe taking inhaler might harm their health overall, is there any like alternative medication available?
There are tablets called Montelukast. You can try in children who are not compliant or it's very difficult to give them inhaler. You can try Montelukast tablet. Very rarely you have to give oral steroids if they're not compliant, but some people do use herbal medicines, but obviously that's not tested or it's not research proven.
So there is no clinical study yet for any medication. Okay.
Herbal medicine.
Okay. Some people do vigorous exercise, like they play sports, football, badminton, things like that, or especially children, they're always like running around and doing like vigorous activity. What is your advice to people who are asthmatic, how to manage asthma while playing sports?
So it's quite good question actually. Lots of patients who are runners and marathon runners, they ask us about this question. So we try to provide them good inhalers, and we advise them to use blue inhaler as and when required when they're doing exercise, especially vigorous exercise, so it can be used. But there's always a limit where your lungs will have the limit of capacity, where you would have to think that this is my limit and I can't go beyond that. But despite that, lots of asthmatics, they live their normal life, and if they're using their preventer regularly and they're taking all the precautions, and if they would like to play sports, they should be able to play the sports.
Do they have to limit the time they can play, or they can carry on as like any other person and taking medication?
Everybody's has got a different tolerability, and they would have to realize that if they're running 5 miles per hour, or if they're running 100 miles per hour, something you have to know about your body.
It is also believed like warmer climate is better for respiratory diseases. People living in the Western countries like United Kingdom, Scandinavia, or America, when they move to or even go on holidays to warmer countries, they feel better. Is mainly because of the moisture in the air in these countries. Is it true?
Absolutely. So the people in England or UK, they when they go on holidays in warm weather, they feel much better. They might have to reduce their inhalers, and they use less of inhalers because they feel better, and there's moisture and air and dampness and colder, and cold weather does cause bronchoconstriction, means your airways will be narrowed and you'll feel worse.
How serious asthma can be? Is it life-threatening?
Yes. So asthma should be taken very serious, especially for teenagers. They don't take it serious, and there's always a compliance issue. And even in very advanced countries in UK, there has been reports of asthma deaths, and which is easily preventable disease. And one of the major factor was found that too much reliance on the reliever. So we would have to strictly tell them they need to use preventer regularly, and they have to double up their preventer if they're getting any asthma attacks. But major issue is compliance, and the youngsters don't take it seriously at all. They feel that this is just temporary, but we do see lots of serious asthma attacks end up in ITU, and some of them would die as well.
That's quite sad to know. So to sum up, what are your recommendations? How to manage asthma? What can we do about it?
So I would say for a physician and for patients should seek help early on in this beginning of their symptoms rather than leaving it for years and years or months and months. So early intervention will prevent you have further attacks. Early interventions will prevent you having all the problems associated with asthma. So early diagnosis, early treatment, early intervention and prevention if there's anything preventable, which could, the triggers which could be like damp or anything which can actually lead on to serious effects of or seriousness of asthma.
Okay, thanks for that. That's quite good recommendations, but as a human, it's not possible for us to follow all the advice. Is there anything if someone wants to just pick up one advice and they say that's gonna save someone's life, what would you say?
So if I would have to recommend somebody, I would recommend them to use their preventer regularly, irrespective of whether they're feeling well or if they're feeling unwell. So do not stop your preventer.
So when we say preventer, which inhaler is that?
Brown inhaler, sorry.
Okay. All right, thank you very much, Dr. Anwar, for your time. It was useful insight, quite good learning for me as well. And I hope our audience has learned a lot from this. If you have any questions, you can send us any questions through the comments, and we'll have another session with Dr. Anwar. We are planning to do some live sessions. Thanks for your time. If you haven't already, make sure to subscribe this channel and share with your family and friends. Thank you.